Hi everybody, it's Dr. Linda of the Vascular Birthmarks Foundation. Welcome to October 2021 VBF Facebook Live. Today we're so excited to be in person with the Laser King himself, Dr. Roy Geronemus from the Laser and Skin Surgery Center of New York. So welcome, Dr. G.
Well, thank you for having me, Linda. It's a pleasure to be here. Good morning, good afternoon, or good evening, depending upon where you are.
And why don't you give us an update on COVID here? Like, how are things going?
Well, COVID in Manhattan is pretty low. The rates of positivity in New York City is, or Manhattan, I should say, is 1.5%. So we're one of the safer places in the world right now.
Wow, I'm happy to hear that. I guess we can't complain. Our exiting governor did a good job with COVID, right?
That he did. Okay.
So we're here today to talk all things laser, but waiting, I see we have some of you coming on, so you can start answer. They're building up. You can ask your questions at any time, but remember, our big super clinic is 2 weeks from today, is the Ultrasound and Dental on October 8th, right here at the Laser and Skin Surgery Center in New York, 317 East 34th Street. Then all day Saturday on the 9th is the super clinic and the free laser and the psychotherapy. So if you haven't signed up, birthmark.org/conference, we still have free hotels and we still have some free slots for free laser. So we're taking your questions. Hi Jody, hi Jennifer, hi Kim. I see you're all on. So go ahead and start asking. Hi Ava Piles. We're able to, let me just see here if we can see. We see them coming out. We're just not seeing any questions yet. Oh, son of a gun. Where'd we go? Sorry about that. Sorry, technology. Kim saying, hi Dr. Linda and Dr. G. I can't believe I missed you today, Linda. Oh, I guess she was here. Kim Brinnington Lane? I don't know, she said she was here. Hi from Pensacola. We're ready to take your questions. Hi Regina. Hi Zox Khalil. He's one of our top doctors from Sao Paulo, Brazil.
Great.
So he's watching. Send us your questions. We're excited to answer. Hello. Oh, so Madison Marklowitz says, my baby boy had his first laser treatment on his face for his port wine stain earlier this month. Does the bruising need to be completely gone before the next treatment? Also, how many treatments does a port wine stain on the forehead usually require?
So there are a number of questions there. The number of treatments, first of all, does vary from patient to patient. It varies based upon the characteristics of the birthmark, the location of the birthmark, and they're all not the same, and sometimes you can't always predict. By and large, forehead of capillary venous malformations or port wine birthmarks respond very, very nicely to treatment. But I tell patients generally no less than 10 treatments, unless it's midline. If it's a midline forehead here, which is sometimes confused with a stork bite or angel's kiss, it's something that can respond very, very quickly, although many of those do disappear on their own. What was the other part of that question?
So you answered, she
About
wanted to know
bruising,
the bruising.
Right. So I do believe, especially with the infants, that the treatment should be at short intervals. We have found that if we treat at 2 to 3 week intervals with the newborns and the young infants, we get a faster and more complete response. So many of our patients do come back with a little bit of bruising, at their follow-up visit. So if there's a minor remnant of the bruising, slight discoloration, we'll treat through that. If it's still very purpuric or black and blue, then we may hold off.
It's good to know for the parents too, because they can watch it for themselves.
That's
and
correct.
See
That's why I sometimes have parents call and say, my child is still very bruised, and we may say, well, give it another week or give it another week or another 2 weeks.
So Omar wants to know, who do you recommend for adults in Miami? I mean, I know Dr. Duarte treats adults as well.
Dr. Duarte does some good work there. Dr. Waybell also does some work with vascular birthmarks in Miami.
Okay, thank you for that. Carla Santos says, hello, may I ask what's your opinion when it is recommended to use lasers to treat a venous malformation, and when is it not recommended to use a laser for a venous malformation?
That's a good question. The smaller venous malformations usually do quite well with laser treatment. Smaller meaning something like you may see in a limited area where you don't have a deep component below the skin, what we call subcutaneous component. So it's very large and very compressible. Then you may be better off with a radiological approach or a surgical approach. But if they're limited, we do very, very well with laser treatment. We see a lot of these around the mouth, sometimes in the mouth, and they can do extremely well.
Sometimes, too, you can use a combination, right?
That's true. And we worked very closely with the interventional vascular radiologists, for the purpose of combined therapy.
So Jeanette wants to know, Jeanette Cavazos, how soon can we begin treatment on our newborn? I know you love that question.
I love that question. My feeling is as soon as you get them out of the hospital, bring them to the doctor's office.
I love it, and I quote that.
No, it's true. It's true. The babies are small, the skin's thinner. You have what's called fetal hemoglobin, in the vessels themselves, which make the vessels a little more susceptible to laser treatment. It can be done safely. It can be done effectively. So the treatments are faster. They're easier for the child. They're easier for the parent. So what you need to have someone available who can do that, is experienced at that, and also hopefully there's a referral pattern where the pediatricians are aware, or the obstetricians, that something like this can be done. But it makes a very big difference.
When you think about it, a newborn's entire head's like this big.
I know, so the treatment's very fast.
Yeah,
so
how many zaps?
You can get through a full treatment so quickly, so very quickly.
In less than a minute or two.
The youngest I've treated is, I had a baby who was actually 6 weeks premature.
Wow.
So who came
So
right in.
you treated before its due date.
That's correct.
Wow, that's amazing.
That's correct.
Jody Lee wants to know, this is not about lasers, but wanting to know your opinion, Dr. G. We are quite diligent about sun protection and skincare for my daughter who has a port wine stain on her cheek and chin. She's 6, and up till now she has participated in mostly indoor sports and activities. So I guess, and she's got a type maybe 3 skin.
I think, first of all, speaking as a physician, as a parent, as a grandparent, I think these kids should live normal lives. And sun exposure is really more of an issue for darker skin when they're undergoing laser treatment, because they can hyperpigment more or turn darker. But that's treatable as well, or that disappears on its own. These children should not be limited from normal activities. They should not be treated differently. Yes, they have a mark on their skin, and yes, it may be progressive over time, but more importantly, they should not be coddled or treated differently. They need to lead normal lives. I feel very strongly about that.
And I think what Jody's saying too, because Meghana is like a medium brown skin tone,
Right,
so
right.
you do she's very diligent with watching it, but it seems like when she goes out into the sun, it does seem to look more vascular, and then, like you say, the pigment starts.
Right, but on balance, you can wear a sunblock.
Yeah.
And I'm a dermatologist. I also treat skin cancer. I treat a lot of patients with sun damage. So, we do recommend that families begin sun protection very, very early with their children. That has lifelong benefit. And, but I would not treat them any differently than I would treat anybody else. Just make sure the sunblock is worn as any other child should do.
Yeah, and that's the thing. We've always talked about that. 6 months and over, right, for sunblock?
Well, I think you can push it earlier if you need to. But look, the little babies aren't going to be in the sun anyway.
Right, that's what I mean, because they
generally
shouldn't be.
In a carriage, they're going to be, kept in a situation where they're not lying at the beach trying to get tan.
Exactly. Let's hope not.
That's right.
So Jeanette, who has the newborn, wants to know if it's painful for the infant.
So there is discomfort, but let's not forget that the most common laser that's used for treating port wine birthmarks is the V-beam or the Prima. And these lasers have something called dynamic cooling, or In some cases of the prima, doctors will use contact cooling. So these cooling devices do provide some pain relief. On the other hand, most of the treatments are very quick and very simple. And most of our patients, the kids are really back to their normal behavior by the time they leave the room, treatment room, and certainly by the time they leave the office. And we did a study that we published where we looked at the analysis by the parents and the physicians about the child's behavior, both during and after the treatment, and the normalization of behavior was very, very fast. So the perception was this is not an overly traumatic procedure. I'm not minimizing it. I mean, it's not easy. It's not easy to be held down and to have a laser treatment. But the discomfort is not tremendous, and it does resolve very, very quickly.
And also, babies get held down for 24 different shots and other things that
That's
happen,
true.
right? You
It's
know,
a little longer than a shot,
I know,
depending upon
but
the size of the
it's
birthmark.
still, you know, we don't think twice about that.
But we were very pleased with the study that we performed in terms of the perception of pain and the rapid recovery time following these treatments. But it's important also to realize that the value of these cooling techniques and minimizing the pain. So it's not just laser treatment. And while we don't give an anesthetic to these very, very young children, they do tolerate it very well.
So Ava Piles, you know Ava, you've treated her. She has face syndrome, and you've been treating some of her residuum hemangioma. She's 21. So she says, "Hi, Dr. G. I'll be coming to the clinic in October, and I was wondering how many of the CO2 fractional laser treatments will it take to remove a scar?" She's got scarring from.
Right. You can't always remove a scar, but you can usually improve scars. So we're very pleased with what we're achieving even in children with the ablative fractional carbon dioxide laser treatments. So it's a very individual thing, and I really can't generalize with a specific statement.
Right.
As
You
to
have
how
to,
long
you have to-
every scar is different. Even on some patients, some scars, some portions of the scar will respond quickly, and others will respond more slowly.
Well, depending on how much of the hemangioma is involved and the collagen and what's healthy and what's not.
Right.
I guess
but-
you do a treatment and
but
you
the,
see.
the characteristics of scars vary tremendously. So you have to really individualize the response to that question.
So Monica wants to know, first of all, she said, many blessings from Florida. Can patients with KTS on the legs get laser? And she also has it on her knee and her leg.
Yes, patients with KTS can get laser treatment on the legs. But with that said, treatment is much slower to respond on the legs. It's more difficult to respond. Many times, if there's extensive KT or underlying vasculature, such as prominent venous vasculature, then working together again with an interventional radiologist can be very helpful. In many of these patients, we recommend to get treated first by the interventional radiologist and then come back and see us. I've seen some cases where treating these patients through interventional radiology, the skin part essentially disappears. So, it depends on the condition. There's a lot of variability.
Again,
So-
we always say this with vascular birthmarks, it's an individualized thing.
It's an individualized thing, and it's often a team approach. And that's the great thing about the VBF. We're not just talking about dermatologists doing laser treatments here. We've got the pediatricians, we've got the interventional radiologists, we've got the surgeons. It's all something that needs to be coordinated if needed.
And now that there's so many people are looking at genetics, we're working with, the hematologists and the geneticists now as well.
Well, this is, hopefully that'll lead to a longer-term cure. Once you can identify the gene and the problem, then, maybe down the road we'll have gene therapy, which will change this field in its entirety.
Would be wonderful. Ahmed has a question for you. He wants to know how long the redness from having a pulse dye laser treatment takes to fade, and would that redness, and I'm sure he means the purpura, would that affect subsequent laser treatments?
So the answer to that is very variable, and I don't mean to be evasive, but a lot depends upon a number of factors, including the parameters of the laser treatment chosen by the physician. So, for example, if one chooses what's called a shorter pulse width, as opposed to a longer pulse width, that's the amount of time that each laser pulse is applied to the skin surface, you'll have a different answer to that question. The shorter pulse widths, when they're utilized, the healing takes longer, the redness will last longer. Different parts of the body responds differently. The face responding the most quickly, and the legs the most slowly. So you have to factor in all of these things in answering that question. But it can be anywhere from a week to sometimes several weeks.
So Carla has a good question. She says her daughter has a venous malformation in her inner cheek. Does mucosa respond differently to laser than the skin?
In many ways, it responds better. You know, I love treating mucosal venous malformations because the response is so good, and the healing is you, as a physician, I can be a bit more aggressive because the mucosal skin is more forgiving. You know, we're less worried about scarring the skin, so I can push things a little higher and get a better response.
That's really good to know. I'm not sure about what Doris means, but Doris Ortiz is asking, what about the use of Botox on the hemangioma area? I'm curious. I've never heard of that.
I have not heard of that either, where the Botox can be used in lots of for different purposes, but I've not heard it being used for vascular lesions.
Yeah, I haven't heard of it used for anything vascular. If there aren't, so Veronica wants to know, if there aren't any prominent polka dots after treatment, does that mean it wasn't successful?
No, it does not. I mean, it's in my opinion, it's always preferable to have what we call the purpura or the dots. But we've done some studies where we've shown that you can do it without obtaining that purpura. I just don't think it works quite as well. We've done something called optical coherence tomography after these laser treatments, and we've been able to identify the destruction of the vessel. And you still do see some injury, even at using the settings that don't cause the bruising. So it's possible, and I have some patients who absolutely don't want the bruising, and they still see improvement over time. It just takes a bit longer to get there.
So I know a couple of you are asking, will Dr. G be at the laser clinic on the 9th? Well, it's his place.
It's in my office, so I'm going to be here.
And it's his happy time doing all of our babies.
No, I love doing that. And
Yes.
I think what we're doing is just an incredible thing that I'm proud of and proud to be part of.
Yeah, so yep, of course he'll be here, and come and see Dr. G.
Well, no, it's not just me that's going to be here. But
No.
We have a group of great physicians.
Oh yeah, we have 14 doctors.
Both not just for the laser treatments, but
Right.
for the evaluation and diagnosis.
Mm-hmm.
So it's really an all-star team. It's quite remarkable what Dr. Linda has done in putting this together.
Thank you. We have 6 teams, and we have port wine team, and head and neck lesions, and Sturge Weber and KT, so everything's covered. You won't be disappointed, and it's still time to register. Mr. Galfour wants to know, can we say that hemangiomas are autoimmune disorders?
I don't think so. I don't think that's probably the best way to describe it. You know, it's a proliferative disorder. Exactly why it's proliferating, we don't know for sure, but I don't think it's an autoimmune problem.
No, I haven't heard of that, although, the old Judah Folkman days of talking about mast cells, and that's related to autoimmune, but again, I've never seen anything published that says that's related. Jennifer Gee says, I've got a port wine stain, very vascular, and my leg is approximately 10 inches larger than the other one. The birthmark, this is a long one, is beginning to raise and become painful. I've had interventional radiology who does vein therapy, sclerotherapy. Is that a preferred treatment? Will laser work on most severe areas? What is the best treatment as a 42-year-old?
Well, certainly one cannot say definitively without evaluating the condition, but I think the combined approach of interventional radiology plus laser could be helpful. Sometimes laser can just work on the blebs or the thickened areas where you're not necessarily concerned about the diffuse discoloration. So you can look at it either way.
See, this is a perfect patient that should come.
That's right.
Because then they can see the extremity expert, the laser expert, the
Right.
syndrome expert, and KTS, and find out exactly what it is and what the treatment options are. So if you can come, Jennifer, we still have free lodging. So we have questions from Lindsay Benedict. Does every port wine stain need an ultrasound? My son is 10 months old, has one on the V3 area up into the scalp. Will we be seeing you soon at the clinic?
No, I don't think every port wine birthmark needs ultrasound. So, the broader question is if you're in the high risk area, such as the forehead, the upper eyelid, extending into the scalp, alone or in combination with the cheek, then neurologic evaluation is certainly important. Ultrasound may not be the way to go for that, and many times for the younger infants, EEGs are done, and then MRIs typically around the age of 1.
And two, I think what she's talking about, we've had a lot of information out there recently about lesions being called port wine when they may really be like some kind of a stain over a venous or an AVM, and they're
Right.
calling them all port wine.
So it's very difficult to make these other types of diagnoses during infancy. And even if something is going to develop into a high flow vascular malformation known as an AVM, that's hard to diagnose by any method. Even the radiological methods are going to not find something that's so small at that point in time. So it's just one of those things. Sometimes it just escapes you because you just can't make that diagnosis.
Barbara Wheeler wants to know, is a numbing agent ever used prior to laser on an infant?
We generally don't provide topical anesthetic under the age of 1, and that's based on the absorption of the lidocaine that gets into the body in these babies with thin skin and small surface areas. So I think because of the speed of the treatment and the dynamic cooling spray, we generally don't need it. So we do just fine without it up until that age, but we do introduce it at about the age of 1. And again, for safety reasons. And, early on when EMLA was first, even before it was introduced, we were bringing it in from Europe to use it. We saw reactions. We saw kids actually turn blue from topical anesthetics, and that's a very scary thing. So, we're very cautious about its use, particularly over larger areas.
Yeah, that's what I was going to say. When you think of a little baby, and if you're lathering this on, people don't realize that's a massive percent of that baby, and you're putting a beta blocker. a vasoconstrictor on it.
Or lidocaine.
Yeah, lidocaine.
So you can get what's known as lidocaine toxicity. You can also get something called methemoglobinemia, where the hemoglobin is destroyed and the kids don't oxygenate very well. That's why they turn blue. They weren't getting the oxygen they needed. So, we learned the hard way early on. This goes back into the late 80s. So, and then once it was FDA cleared, the clearance was really not for anybody under 1. So we stick to that.
And we see that all over.
But keep in mind that these laser treatments have gotten faster and faster. The technology's better, the spot sizes are larger. One of the reasons why we are sometimes using the Prima, the V-beam Prima, for some of these larger birthmarks, because it has a large spot size. And the larger spot size does a number of things, not the least of which is the fact that you have a much faster treatment. So if you think of your good old math, we have pi r squared, r being the radius or the spot size. If you square that, think of the difference in speed. So where you're using a 7 millimeter spot size, and that's a square of 49 versus, a 12 or 15, you're talking about increasing your speed, 400%, a difference. It's a big, big deal for these kids.
Yeah, so you're saying something that might have taken you 4 minutes now is around 1 or 1.5.
That's correct.
Mm-hmm. And that's really important.
It's really important as it relates to this pain, the pain concerns a lot of patients have.
Yeah.
And one of the things we're looking at now is to see what the benefit is of those larger spot sizes. So as we've done more and more of the work with the Prima, we're pushing more and more towards those larger spot sizes, with the idea being that we can get a little more penetration into the deeper blood vessels.
Good to know. Emily wants to know, what are the laser treatment options for a diffuse venous malformation on the ear, jaw, neck, as well as internal structures? My 18-month-old has a VM, wondering about the optimal timing. This person and risks of laser is like perfect to come to our conference.
Yes, this is a complicated problem that your child has, and I think it probably would be a multidisciplinary answer to that question. In terms of combining therapy between interventional radiologists and a laser surgeon.
So Lilia says, my daughter is 4 months old with a hemangioma on the soft spot. It's mixed. We saw 2 providers. Both did not recommend any imaging. However, the neurosurgeon ordered an MRI, which we declined due to anesthesia risk. Do you send your patients for imaging when a hemangioma is on the soft spot?
I don't think it's a bad idea, just to make sure there's no communication with anything underlying. So, one can also start with an ultrasound, perhaps, as a starting point, just to get a sense for how deep things might be. And if there's a suggestion of significant depth, then one can proceed with a further study, which would be an MRI.
A lot of people are asking if you'll be there on October 9th, so we'll just say it again. Dr. G is the host of the October 9 Super Clinic with the free laser, free diagnostic clinic, and psychotherapy sessions. And we also have dental and ultrasound on Friday.
Yeah,
so
maybe you want to mention some of the other physicians that'll be there.
Dr. Weiner, Dr. Rosen, Dr. Coletti, Dr. Friedman, Dr. Stuart Nelson, Dr. Francine Bly, Dr. Branko Bacevic. It's Dr. Pinto and Comey, the Sturge-Weber experts, Dr. Buddy Cohen. It's a great list.
It's a phenomenal group of physicians. It's really people who are extremely experienced and very thoughtful.
And thank you for our staff that's posting Dr. G's address for everyone. I think Emily is on, so thank you for that. Are darker skin types, skin type 4, treated any differently for facial port wine? If so, how?
Yes, we do always consider the skin type in determining the parameters that are used with the laser. I'm more inclined to go with longer pulse widths and slightly lower energies in dealing with darker skin. Years ago, when we first started doing this, I stayed away from the black, the real dark skin, what we call type 6. And thinking that it would cause problems, because we did have some problems until we figured out how to do it right. But now I have quite a few number of black or type 6 patients who really do very, very well with treatment just by using a lower energy and a slightly longer pulse width. A lot of it comes down to a game time decision. The physician has to look at and see what the skin reaction is and make an adjustment accordingly. So in darker skin, if you see too brisk a reaction, you've got to pull back a little bit. Dr. Linda and I were talking before this session about inexperienced physicians and extenders doing these types of procedures, and it's that type of clinical judgment that I think is important to optimize the outcome, particularly in the more challenging cases of patients with darker skin.
And that's why when patients contact us, if we're not familiar with someone's work at all, we can't give a recommendation, because we can't say what somebody does if we don't know anything about their experience. Well, and like you were saying with skin type, I think people need to know, because a lot of patients, when they get to the type 3, 4, 5, 6, they're seeing white spots from the laser.
Right. Fortunately, those white spots typically go away.
Right.
With time, but it's concerning when they do happen. More likely to happen with somebody who's tan, somebody who's darker. But you do want to avoid any textural change that might lead to permanent scarring.
Jessica Fix wants to know, how frequent should a 7-year-old who's had 24 laser treatments continue, and how many per year? I guess it's hard to know without looking, right?
Yeah, I think you have to evaluate the condition, and the other thing I'd like to do when I get this type of question is to look at how the treatments were performed previously. So if they were very conservative, or if we might have done something a little bit differently, then it might be worth, in some cases, starting all over again. In other cases, if the treatments were done in a fairly aggressive fashion consistent with the most appropriate method of treatment, then I would probably wait longer between treatments and give it some time to settle down, and sometimes we do see delayed benefit.
It's great. I love this question. Bianca asks, how do you know how deep a port wine stain is? And if it is deep, is it harder to treat?
The answer is yes and no. So again, we've done some of these imaging of the birthmarks and have found that sometimes the more superficial vessels can be more challenging. So I think we're going to be at a point somewhere along the way where we're going to have real-time feedback. So the laser will be able to image what's going on, or the technology will image it, and then the laser will fire based upon the characteristics of the blood vessels. So this is a very variable condition, and it may vary even from one part of the body to another on the same patient. So, this is why it's so complex. Everybody is not the same. You can look at a vascular lesion and get a different response. I think an experienced physician will be able to predict that by and large, but sometimes it's much, much harder to do based upon the diversity or heterogeneity of the blood vessels.
Thank you on that one. Great question here from Kylie. She says, have you ever met anyone or treated anyone with the RASA1 gene mutation for CM, capillary malformation, AVM, on top of a malformation? She's had sclerotherapy, and that impacts her mobility, and she has to take naproxen twice a day. So she's asking if her child has this RASA1 capillary malformation, AVM. Is that something that can be treated?
Well, in our experience, if you can control the AVM, the response to laser treatment is far better. So, if you have a high flow of vascular malformation, like an AVM, and you have a significant skin component, it's going to be very, very hard to treat as long as that high flow blood is coming into the skin. But if you can control the source of the faucet, so to speak, turn off the faucet, then you'll be able to clean the sink a little bit more easily.
I like that analogy. Mandar says, we saw great clearance in just 2 laser treatments on low settings for our son Viad's facial port wine. Does that tell anything about the birthmark, like if it's superficial, or is there any correlationship between the clearance rate and how quickly it will darken again?
There are a couple of questions there. There can be variability in terms of the response, and some of these are just very, very responsive to laser treatment. I'm curious to know how old your child is. But one of the things we have found is that the more we clear, the less likely you are to get recurrence. So I'm not of the belief that all of these recur over time. Some doctors are. But I think it's based upon the degree of clearance that one achieves. So the more you achieve, the less likely it is to come back over time.
And so the ones that get 90% or better clearance are the ones that you find aren't coming back?
They typically. Who knows?
All things being equal.
We have not done this forever, but I have patients who are in their teens and 20s now who were treated as young infants who have not recurred, and have others who come in periodically for maintenance therapy.
And that brings up the next question. She says, Jeanette says, once we complete treatment on our child's port wine stain, will there be an end to treatments, or will treatment be lifelong? I guess she's talking about maintenance.
I think that, it depends. If you do get the complete clearance, somebody's saying they're not hearing us very well, so maybe we'll come a little closer here.
Oh, sorry. I didn't see that. Oh, okay, sorry. Is that better?
Just going back to this question, I got distracted.
The one on clearance, like maintenance.
Yeah, maintenance may be necessary. So when it begins to become darker, it's probably the best time to begin to approach it again.
Okay.
And hopefully it's not like starting over. It's you need fewer treatments and certainly less frequently.
So Christine Latona wants to know, she can't come in October. When's the next one? Dr. Friedman, who is actually a mentee of Dr. Geronemus. He's on staff here and he has a practice in Houston. So we have a free laser clinic on December 4th in Houston and in Miami with Dr. Duarte on January 9th. So next year we're going to have 6 free laser clinics worldwide. We're very excited about that, and you can find that out at birthmark.org/laser. Okay, so now we have another one. Is it always necessary to have an MRI before beginning laser treatment if there's a venous malformation in the inner cheek?
No, I think it depends on the extent of the venous malformation. Some of them are really quite limited, and there's absolutely no need to get an MRI or any kind of radiological study. So the extent of venous malformations can vary from something very tiny to something very, very extensive. So there's a wide range, which makes that question difficult to answer, but there's no absolute need for all of them to be studied.
Thank you for that. Does laser reduce the swelling or enlargement when you have KTS of your leg?
It does not, and that's an important point. The laser is just for the skin. The patients with KT, Klippel-Tregonese syndrome, typically have much deeper involvement. So the laser just is not going to get to the depth. So it's really more for the appearance of the skin and to help prevent some thickening or nodularity, the cobblestoning of the skin itself.
Gina Sutphin wants to know, does a port wine stain always blanch with pressure? It's on my cheek. It does always blanch and has genetically been called a port wine by primary care doctors. So does it always blanch?
They blanch differently. And the founder or the inventor of all of this technology, Rox Anderson, believes that if you compress or press on the skin and it takes more than 3 seconds to refill or for the color to come back, then that patient's going to do even better in terms of port wine stain treatments. I think that's often true, but not always true. So it can be a helpful sign, but it's not an absolute sign.
Olivia wants to know, an AVM has been ruled out via MRI, but the lesion feels very warm. What does that indicate?
It's hard to say, and a lot depends on how old the child is. Sometimes the MRIs can't pick it up. Sometimes you need something called an MRA to pick up an AVM. The warmth does suggest there's increased vascularity, but it may not necessarily mean an AVM.
Ahmed says if his port wine has not responded to a pulse dye laser, what are his other options?
Well, the first thing I want to do is look at the parameters that were used with the pulse dye laser. Which laser was used? What was the spot size? What was the pulse width? What was the energy? So these are all important factors. So that is still the safest and best option for most port wine birthmarks. There's some people, and I'm not one of them, that like the Alexandrite laser for the purpose. I don't think it's as safe. We've seen more problems coming from the community when people are treated with the Alexandrite laser. But if there's nodularity or thickness or cobblestoning, I'll often use a YAG laser, an IDYAG laser, which I think is perfect for these thickened areas. It really works quite well, where they often disappear very, very quickly.
That's really great to know. Kylie has an interesting question. Both of her kids are diagnosed with the RAS1. One sibling has an AVM that was surgically removed. She wants, and she said more are presenting. Will they slow down? I guess nobody really knows the
I don't
answer
think we
to
have
that.
an answer to that.
No, but I'm curious too. If she can't come to our clinic to see our AVM experts, then maybe we can put her in touch with someone, because if he keeps having more and more lesions pop up, it may not be just AVM. It could be like a Cowden syndrome or some other syndrome. So you can email me and we can maybe hook you up with Denise Adams or Dr. Denise Adams or Dr. Bly to look into these multifocal little AVMs that keep popping up, because that's indicative of a syndrome of some sort.
Sure.
Ashley Hedrick says, my son has a stain on his scalp. Are these typically treated? If not, is it possible to steal a cheap is it possible to, steal a cheap 90%? Oh, still achieve. I guess I auto-corrected it to steal a cheap.
Okay.
Can you still achieve 90% clearance, and his is on his scalp?
So it's an important question. I generally don't treat the scalp, the lesions within the scalp, particularly for the very young children, because even with light hair, you can see some hair loss that can be very, very prolonged. So, I tell patients that by the time these kids are older, there'll be something better, and we'll be able to treat into the scalp. So I wouldn't really worry about it right now. The hair is going to cover it. The thickening that one sees, the cobblestoning or the bleeding that can occur, typically doesn't occur until 30s or 40s. And you have 2/3 of all patients by the age of 45. They're going to have some thickening of their port wine birthmarks. But until then, I'd place my bets that what we're talking about today will be ancient history, and will be something easier and better to address that type of problem.
So what percentage you say would have some thickening in their 30s or 40s?
2/3.
2/3?
Yeah.
That's significant.
Yeah, but it could be anywhere from a few little bumps,
right,
the cobblestonings, or to very significant, where it gets very, very thick.
But this is why we recommend earlier the better.
It's aside from the psychological benefit, I think that this is the real medical reason to treat these, because these bumps can bleed. Men who are shaving on their face, people who are combing into their scalp or hairline, other people who are, women who are shaving their legs. There are good reasons to want to keep these things under control.
Jennifer Arnold wants to know if you recommend lasering on the lip when there's a port wine stain on the lip.
So I do. I'm a bit more conservative, and I don't treat as often on the lip because I'm a little concerned about whitening and losing the natural color of the lip itself, known as the vermilion. So, yes, I do, and I think it can be helpful.
Rachel says her 5-month-old has a port wine over his eye, forehead, into his hair line, and goes as deep as his derma. Unfortunately, Ontario, Canada is behind in the laser world. Does it really make a difference to get laser as an infant to get the best clearance based on options here, and he may be 2 or 3 before he can get his first treatment? Also, how can you tell if the skin is thickening? So I guess those are a couple questions.
Well, I'm sorry the Canadian government can't offer more to the patients there and the kids with the birthmarks. We have found that treating the babies leads to a faster, more complete response. Not that we can't get a response later on, but keep in mind, you've got a 2-year-old coming in for treatment as opposed to a newborn. The 2-year-old's going to be running around the room and is be much more aware of what's going on. The birthmark will be larger. The skin will be thicker. You don't have the fetal hemoglobin. There are reasons why things won't be as fast and the response won't be as good.
And I just want to add, for the woman from Ontario, you get a lot of patients from Canada because they don't believe in early intervention, or it's difficult to find anyone.
Some of it is maybe related to the National Health Service that they have in Canada, where they have more limited resources.
Mm-hmm.
So, I don't know the specific reasons, but, there is rationing of care to some degree.
Well, what I wanted to say is, because we have 9 patients coming from Canada for the clinic.
We have similar issues in Great Britain, correct?
Right, the same. And that Dr. G offers a flat VBF fee for people who will come back and get repeated care. So you can have continuity of treatment. You just have to travel for it. But
right.
We have it here in the U.S.
Yeah, there may be people doing this in Canada. I'm just not sure.
Yeah, we've been trying to find them too. Jennifer wanted to know, just bring whatever imaging you have for her KT and extremity. Whatever imaging you have, just bring with you any records.
If I can add, anybody coming for a consultation at this conference should come with as many records as you can
Yes,
bring.
thank you.
You know, if you're coming in for laser treatment, it's extremely helpful to know what was done before. So this can act as a guide for future treatments. You know, if you're not getting a response, it can help us explain maybe why you're not. If you're having side effects, we can perhaps explain why that's happening.
And like you say, always looking at the settings, and that really tells you a lot.
Yeah, it's not a cookbook
No.
treatment. You know, it has to be monitored and adjusted based upon the circumstances.
So this is a good question. Ahmed wants to know, like, how can you tell in a baby which ones are going to become have hypertrophy? Like, is there a way of knowing which port wine stains will become hypertrophic?
I think on the face, if you do see vascularity, let's say, for example, inside the mouth, particularly in the lower lip, inside the lower lip, you're more likely to get thickening in those areas. It does suggest that there is a deeper involvement of the vascularity. So many times when we see a patient in consultation, we'll look inside the mouth to get a better sense for what's going on, or if somebody's not responding, because sometimes you can't see it early on. Many times you can see when the baby cries, so you don't have to really even make much of an effort to make that analysis. But I think it can be predictive. That if there's deeper suggestion of deeper involvement, through by examining the mouth as an example, it could be very, very helpful.
One of the things I learned from Dr. Comey this year was that the intensity of some stains can also be predictors for Sturge-Weber. Like if she sees a real broken stain around the eye and it's very pale, she says it's not as risk as an intense, fully confluent stain.
Yeah, I think that's true.
Yeah.
Because we do see a lot of these kids coming in where we do the test just to be certain, where they have the fragmented birthmark or small areas. But if you do see a child where it's, for example, all the way from the eyelid into the scalp without any breaks, that is a higher risk. I would agree with that observation.
Amanda wants to know, how effective is compression only for the treatment of an extensive intramuscular venous malformation from the hip to the toe?
That's really not my area of expertise. I know Dr. Rosen will be at the conference, who's really one of the world's experts at extremity vascular malformation. So.
And Dr. Delphinian, who is a compression garment expert. So again, we have all these resources at our super clinic on October 9th, and if you can't come, we can give you, through our Ask the Expert on our birthmark.org/Ask the Expert, you can ask these doctors questions directly that you don't get answers to here. That may be an area that Dr. G doesn't cover. Michelle Lima says her son is newborn, 3 weeks old. Is the clearance good on the cheek? It's mainly on his cheek and a little on the side of his head. I'm in Canada. Do you recommend him having the laser done ASAP, or will it be okay to wait until 1?
There's certainly no harm in waiting till 1, but I do think there's a window of opportunity in treating the newborns. Again, we talked about it before, about the smaller birthmarks, the thinner skin, the fetal hemoglobin, the ease of treatment relative to older kids, all make it much more beneficial to begin very, very early.
Lisa Murda has a great question. She says, I can see the port wine stain inside my 15-year-old's mouth, but no teeth deformities. At birth, the neurologist said nothing on the brain. Do you think MRI may see something now or rule it out? I know Dr. Comey says it's ineffective before age 1 to have an MRI.
Right, that's why she often does the EGs, for those patients.
So this patient should see, or at least speak to Dr. Comey or someone, and they'll assess it and determine whether it needs imaging.
Or the local pediatric neurologist.
Yeah, or come, because he's 15,
Right,
so
right.
he's still in pediatrics. Is there a way to laser treat my port wine without removing it? I'm 47, so I'm just now starting to get some bumps. The port wine is only about the size of a quarter, I want it to stay healthy, but I would actually be sad if it were totally removed. We've been together a lot of years. I've talked to a few people like this where they want the bumps, but they want to keep the stain. And you can do that, right?
Well, there are others who, you mean what they want the bumps removed?
Yeah, they want the bumps.
Yeah, we do it all the time.
Yeah.
We do it all the time.
So some people
Right.
say, look, I don't want it gone.
That's correct.
I just want it healthy. And that's an option.
Sure.
And we support it. You know,
Yeah.
some people don't want to treat. We're like, we do treatment and no treatment. We
No,
accept
I think
all
I did a
choice.
couple of those this week, just for that, in that scenario.
Carla wants to know, is it possible to completely resolve a venous malformation, or is it a continuous treatment the patient needs to have throughout life?
I think it depends on the extent of the venous malformation. There are some that are completely curable. There are other deeper ones that really go through and through. For example, from the outer part of the skin into the inner part of the mouth. Those are more challenging, and those will require maintenance in all likelihood over the long term.
Interesting question from Jennifer Arnold. Is it common for facial port wine stain to be full thickness, meaning gums, inner cheeks, and throat? Do you ever see hypertrophy in oral areas?
Yes, you can see some hypertrophy in oral areas. The most glaring example of that is the lower lip. So, if I see a young child or a young adult with vascularity of the inside of the lip, what we call the mucosal surface, that person is more likely to get thickening of the lower lip over their lifetime.
Okay, well, we have 9 minutes left before we have to sign off. It's been so busy I didn't even look at the clock. It's only 9 more minutes. Bianca says, if you don't see a lot of change after 10 or more treatments, should you take a break, or can the skin eventually take it better? I know what you're going to say. You need to look at the settings.
You got it.
And the parameters, because there's a reason with 10 treatments they're not seeing some clearance.
You've been listening, Linda. That's a good thing.
Yep.
So I think that's true. First, look at the parameters. Second of all, taking a break it can be very important. Sometimes the areas remain red. The other thing is to look carefully at the skin. One of the problems I sometimes see, often see, patients come in and say, my child's birthmark's not getting better, my birthmark's not getting better. They often have an eczema or dermatitis on top of the skin, which confounds the picture. So first of all, a rash or dermatitis is more common in port wine birthmarks, and it's even more common in port wine birthmarks that are being treated. So that's something that's important to evaluate. But I think taking a break is a good idea. At some point, checking the parameters, or even adjusting the parameters going forward.
We got to get a few good questions in. Ahmed wants to know, if the room is cold when you're doing a port wine stain treatment, and he notices his daughter goes lighter in the cold, will that affect the treatment?
I don't think so. I mean, there's some people who try to adjust the temperature. I know Stuart Nelson has done that, where he's looked at different temperatures and even different positions of the table in the room. I'm not convinced that it makes a huge difference. But one of the studies we did very, very early on with this topical anesthetic, the EMLA cream. The EMLA cream constricts the skin, constricts the blood vessels. And we did test sites in birthmarks, both with and without the EMLA, and did not find a difference. Mm. So my guess is that the constriction or the dilatation of the blood vessels will not make a difference in the ultimate outcome.
Paula has a great question. Her 21-month-old has a port wine, and they see a little darkness on the tip of the tongue, and they believe that that's port wine as well. Can that be treated?
I suppose it could. I'm not sure it's worth it. I think that would be more uncomfortable for the child. So it's possible, but it would be a little bit more uncomfortable to do.
And maybe should be evaluated to see if it's
sure.
a port wine,
make sure it's
or
nothing else.
Something else.
Exactly.
So Ashley wants to know, I mentioned about when a port wine is broken up and it's what we call geographic or
Right,
broken, that
right.
they grab the laser a little better, and she wants to know, is it true, and do they get better clearance if you have all good skin peeking around the stain?
I've not seen much of a difference in that regard.
Olivia says, if an MRI, MRA at 11 months rules out AVM in the brain, do you recommend another MRI later in life?
Well, I'll defer to the radiologist on that one, but I think that's really too young to rule it out. Just historically, I've seen some of these AVMs rear their heads at a later date when the kids are older.
So this woman's asking the same question, Michelle Lena. Once you reach maximum clearance, is that it? Are you done, or will you need a maintenance treatment?
The question is, how do you define maximum clearance, and what happened to get to that point? Have you exhausted all the different laser parameters and laser options? So, if you have, then, there's always a possibility that maintenance will be required.
Right. And I guess, too, the best judge is if they see it coming back, come in.
That's right.
Right?
And that's what we advise
So
patients.
the first sign of recurrence, you come in, and I've heard people say they haven't had recurrence for years, and others say months. And I guess that's how variable it is.
It's variable. Again,
Yep.
a number of factors that fit in there.
So if this port wine is on the scalp and around the eyes, is there a greater chance of brain involvement from Sturge-Weber?
Yes, there is a greater chance.
And we have a booklet on our website at birthmark.org/Sturge-Weber syndrome booklet, which I worked on with Dr. Comey, and it answers all these questions. It's free. Go online. You can see the 50 top questions asked by parents of children curious if their child has Sturge-Weber or if they have it.
It's really well done.
Thank you. Yeah, we're really happy. We're working on hemangiomas now. Okay, everybody's thanking you. Can a port wine stain naturally lighten in the first year of life before it darkens?
There have been cases. I know, Linda, you have some of those where there's been spontaneous lightening. It's a very unusual thing, in my opinion, but we have seen proof that can happen, and sometimes it can lighten, and that's it. But I think that's a very rare phenomenon, extremely rare phenomenon.
Well, we are wrapping up. It's 6:27, and once again, we do still have openings for free laser, ultrasound, dental, and orthodontry, as well as psychotherapy and the mega clinic, where you can see multiple teams of specialists. And we still have free lodging. So for more information on that, go to birthmark.org/conference. You can read about it. It is only 2 weeks away, but we don't turn anyone away. Even if you show up on the day of, as long as you have your COVID compliance, and we will be requiring that, and anybody who registers has to provide proof, and we do testing here. So we're going to be, and everybody's going to be wearing a mask, except in clinic when they're looking at you or getting your treatment. So anyways, I want to thank Dr. G for his time today, and thank you all, and we hope to see you all soon. Stay safe, stay well, get your vaccinations, and we'll see everybody in 2 weeks.
Okay, well, thanks for having me. It was fun.
Thank you all. Take
Okay.
care.
Take care.
Bye.
Bye-bye.